Hello everyone, we are here back at Integrative Pediatric Therapy and Integrative Concussion Therapy. Of course, we have Dr. Sally, who is setting up as our patient. Tell me a little bit about yourself and what we're doing here today.
Okay, so we're super excited to bring the RightEye to our clinic. It's a state-of-the-art piece of equipment that analyzes vision from the reading of your pupil. So it reads your pupil 500 times a second, which our brain interprets that information only 23 times per second. So it gives us very, very specific information that is not visible by the human eye. So what we brought this to our clinic for is just post-concussion or with sports enhancement, we see some visual challenges that are present that aren't noticed by an optometrist visit or even an ophthalmologist visit. So this software specifically looks at how the eyes are working together, but also individually their movement and their coordination based on the nerve and the muscle control. So
I'm going to let you come in here so that you can kind of explain to everyone what's going on, because I have no idea what I'm looking at.
So on the screen, it's a black screen and it has a white dot currently, and Sally is scanning and following that dot to the best of her ability. What the software is doing is it's utilizing a camera on the bottom side of the screen that's taking a reading of her pupil and the movement of her pupil, like I said, about 500 times per second. And so as she's doing these screens, these tests, it's looking at her accuracy specifically and also her speed of control. So this is Saccades, so she's switching back and forth between two targets, which is very specific to sports performance and reading. Even somebody's ability to be aware of what's going on in their environment and knowing, are they in a safe environment versus a threatening environment, their eyes being able to jump back and forth between different targets. So it's our vision is our number one sensory organ. That's where we get a lot of our information, and so it can create anxiety if that information is inaccurate. It can create cognitive fatigue if our brain is trying to process the images from both of our eyes and they're not matching. So maybe there's a weaker eye and a stronger eye.
Right.
And so we see things like headaches, we see things like eye fatigue, excessive blinking, we see things like short-term memory challenges because we use our
all
visual
from this test.
So this test will tell us if there's an indifference between your two eyes, so if there's a weakness or if there's a muscle weakness in one of your eyes. It'll also tell us, again, if our eyes aren't teaming together. And so if your eyes aren't teaming together, they actually get two different pictures, and the brain is trying to merge those pictures.
How confusing.
Yes. And so the brain gets exhausted. It uses a lot of energy just trying to process that visual information. And like I said, that's your number one kind of sensory organ. So your brain relies on that information really heavily. So if it's working extra hard, we see a lot of cognitive challenges. We see it a lot in our older adults that come here for wellness, and a lot of people chalk that memory deficit or the mental fogginess or poor short-term memory to just aging.
Right.
And it does have some foundation in that because our eyes progressively do weaken over time. But there is optimization. You can do eye exercises and you can do therapy to maintain that as long, and improve that.
Right.
So,
that's so interesting. And actually, you know what? I'm going to step behind the camera so that I'm going to actually pop this out so we can kind of go over her shoulder. I'm going to hand that to you.
Thank you.
Alrighty, let's see here.
You're going to love this one.
Okay.
So what Sally's doing right now is she's actually doing a choice reaction time. So this adds an element of cognition to vision. So she's pushing 1 for alien, 2 for an astronaut, and 3 for the Earth. And then what the computer is measuring is how fast her eyes see that it's an alien, and then how long it takes her to push the button. So it's looking at a visual reaction time and a motor reaction time, which is essential when you're an athlete. So say a quarterback, for instance, has speed because of his demands of his position, but he doesn't have accuracy, then he's not going to be able to deliver that ball to the wide receiver on time and complete the play. But on the other hand, somebody who has accuracy but doesn't have speed might be an archer or a gunsman. Somebody that has speed and accuracy both might be a baseball player who's an outfielder and has to catch that ball. So read the depth perception and read the speed it's coming at him, and then hurry and scan those bases to be able to pass that ball and make the play.
That's interesting how it relates kind of to everything. And I'm going to just flip this around quickly here. Oh, hold on.
So now Miss Sally is actually doing a variation of the test she's only hitting if she sees an alien, and she's ignoring when she sees an astronaut, and she's ignoring when she sees a Earth. And what that's looking at is a measure of impulsivity. So also with our players and with our sports performance, you want that impulsivity level to be very low. With some of our sensory children, they have poor impulsivity control and poor regulation, and so we'll see that this is challenging for them too. So this is just another reading of also focus and attention. Thank you. So this one gets very specific. This is contrast. So it's looking at her ability to differentiate, are those lines vertical versus horizontal? Again, this is the eye accuracy component. Yes, it gets very, very difficult to read.
Laurel Robinson has given you a thumbs up.
Awesome.
They're enjoying the video.
So
So explain one more time, kind of just people who are just tuning in, a little bit about what we're looking at and what this is kind of testing, just kind of an overall quick view.
Okay, great. So on the bottom side of this screen is a piece of equipment. It's software that reads the retina as it's moving. So the pupil as it's moving, and it's measuring 500 times per second eye movement. So it's giving us a very accurate readout. The report is going to give us an actual physical representation of that eye movement. And this is looking at treating each eye specifically independently. So Sally's covering her right eye, and she's looking at this letter on the screen, and the letter on the screen is slowly getting smaller and smaller. So this is actually testing her visual acuity in each eye.
I may need more glasses.
So she's actually completing the sports assessment, the sports vision assessment right now. And what it's looking at is her static acuity. And then next it's going to have the letter move across the screen fast. And so it's looking at her ability to track a moving object. So she's responding in relation to that C, if it's opening to the right, to the left, up or down, by pushing the arrow button. Again, it's looking at her speed and accuracy. It's measuring her eye reaction time, and it's measuring her motor reaction time during this test.
I don't think I would be a baseball player.
So baseball players, actually, I'm glad you made that point, Sally, are required by their sport to have the best visual stability.
Finished.
Yes, baseball players actually have some of the highest scores when you look at their ability to track a moving object and stabilize a moving object, and you can see how that demand is required in their sport.
Wouldn't want to get hit by a ball.
Exactly, exactly. I actually have a sport readout that I can show you that's based on a baseball player that sustained a concussion and his visual skills that have been impacted.
That's interesting. So what is she trying to do right here?
So she's tracking that small dot up and down. So this is looking at her ability to track a moving object in the vertical plane. Vertically, it's very difficult to track an object, usually more difficult than horizontal, because you have 3 different muscles that are controlling that motion in your eye. Compared to horizontally, we tend to utilize that more in our day-to-day as well.
So once you kind of get this test, what are the next steps? Where do you go from here?
So I'm going to go ahead and divert you over to this report so that we can talk about some results.
Pass with flying colors?
I hope so. Let's say.
So the sports vision, you can actually choose if you are considered an amateur athlete, a college athlete, a professional athlete, and it will give you comparisons based on that. So they have comparative norms, and they actually,
I can hold that for
thank you, ma'am. They actually create a printout like this, and it gives you a hierarchy of the 4 different components that are required for sports vision. So functional is your visual acuity, your eyes being able to stabilize on an image, and your ability to recognize that contrast sensitivity. The next level is the actual mechanics. So the eye nerve health, the muscle control. So is there a muscle around the eye that has a weakness, so it pulls the eye, or overactive muscle that pulls the eye in a certain direction? So we've seen, eyes turning in, eyes turning out. that is to the naked eye sometimes so severe that we can see it, but there are also muscle pulls that we cannot visually see, especially because they only happen maybe when our eyes look down, it pulls out to the side. And so that gives us very accurate information. But this is where our ocular motor control comes in and how the brain-eye coordination works. Mm-hmm. The next one is the mind-eye. So that's that processing piece. So whenever it was looking at her visual reaction time versus her motor reaction time when she hit the button. And we want to see that to be optimized specifically in all sports. And then on field is your distractibility, so your focus and attention measure, and then that impulsivity, because we want our athlete organized and engaged in play. So it gives a percentile rank here based on the scores, and I like it because it gives them a bronze, a silver, or a gold medal, and that's easy to understand. So, for instance, this is a baseball player, like I talked about, who we would expect to have optimal visual stability. Post-concussion, he's scoring at a 5% in this processing piece.
That's supposed to be super high.
Yes.
Okay.
These two top pretty much need to be within the 99th percentile.
Whoa.
Yes. And you can see that his ability to stay engaged, his impulsivity is well controlled. He's at 100% there. But whenever we get into his breakdown, his eye motor control, he drops down into 29%. So overall, that affects this building block in this pyramid, and that brain-eye connection is affected.
And this is after he has a concussion?
Yes. So he's in the acute phases of concussion.
Yeah, and then this guides us for how we want to treat him, so we can have an appropriate treatment plan that's going to focus directly on those areas.
Mm-hmm. So for something like, kind of for each one of the pillars, what would you guys, what would you work on?
So the bottom pillar is your acuity and your ability to stabilize your eyes. And so that might come in the form of a prescription. So that might be support for nearsightedness or farsightedness for acuity. If your acuity is challenged with that moving target, that's different. We're adding a different control to the eye. As far as the mechanics go, the ocular motor behavior and the eye strengthening piece, as far as the musculature goes, there's a lot of vision exercises that we can do to do that. Just like you would exercise a muscle at the gym, you have certain exercises that you're going to pull that eye in different directions and really train that muscle to become stronger. As far as the mind-eye, that's when we really work on a lot of multitasking things. So while you're doing a vision exercise, we're going to add cognition to it. We're going to ask you to balance on an uneven surface. So we're going to be working on multitasking different systems and trying to recreate kind of that high intensity reaction of the field. The last part is actually taking it into sport-specific drills and getting you on the field, running your plays. If you're a quarterback, running your drills in your certain spots to your receiver to go ahead and pull that piece back into your sport.
So after you kind of work on a lot of this stuff, do you retest and kind of see how they're doing?
We do. That's the best part of this. So this system, once it finds these deficits, it brings them to our knowledge so that we can focus on them with very specific eye exercises, but it also offers some eye exercises that you can do on a patient portal. So the patient would log in from home and be able to complete exercises that I specifically give them, and then every couple of weeks we'll bring them back in and we'll retest them and be able to document their progress. So really
That's
awesome.
Huge.
Yes.
That's absolutely great.
I want to show you this one. This is the reading test. This is great because everybody wants to know why their kids are having trouble reading. And this is a great way where we can see where they're actually looking when they read, and we can then make those accommodations. So I'm going to read this, and it's going to read my eyes.
So when you're reading a paragraph, your eyes should track left to right, and they should have what's called saccadic or fixations. So fixation means where your eyes fall on the word. When we're early readers, we might break that word down into 2 syllables, and so we might see 2 fixations per word. As we become more versed at reading, then we're going to maybe go every word or even omit small words like of, the, and we'll see those fixations kind of fall on the larger words that make a complete sentence. As you become a speed reader, you may see that people have less fixations and will you're fine. And we'll just get an overall picture of the paragraph. So we shouldn't see that type of reading in a first grader or a second grader. And usually we see delays in reading or a challenge with reading endurance because they don't have the ocular motor control. So their eyes aren't able to stop on those words. They tend to move around the page. They tend to skip lines. They tend to omit multiple words at a time. A lot of the times what we see is with distractibility and poor focus and attention, that those eyes are taking some words from the top line and some words from the bottom line. And so they're mixing sentences, and so their reading comprehension suffers. So whenever they're asked questions about that material, they can't give you a solid answer, or their facts might be off. They might be disrupted because the information that they read and processed is different than what is provided to them.
Interesting.
So after she reads, she does a comprehension test, and these are all fact-based questions. Some of the questions actually ask about material that's not even present in the paragraph to see, again, the focus and attention piece to say, was it provided or was it not provided?
So it's like a simple version of the SATs.
Yes. I want to show you the report on this one, and it has a playback option, which is really neat and really gives insight to the parents because it shows which each eye is doing independently, and then it shows you which your eyes are doing together. It also will give us a really pretty colorful idea of what her eyes were doing throughout the paragraph.
Now keep in mind I was very distracted when I was doing this.
Sally, I'm going to have you hold this so that I can pull up the report.
All right.
Let's pull up the sports one first so you can...
Oh, so we're seeing all of them now.
So there's Sally.
Sorry for the shakiness, guys. We're just getting all set up here.
So this is the Sports Vision IQ, and it has the playback version as well. So I just want to show you that. It's loading up for us. So Sally did pretty good, except for that multi-tasking, which is challenged right now with her trying to stay on top of us. But what I love about
champ, those are good numbers.
I know they are good numbers. And one thing I didn't say is, when you choose which athlete that you want to be compared to, these are current college athlete norms. So, for instance, a college athlete that is on the field right now is testing with a score of 98, and Sally was at an 88 for that task. The top 1% of college athletes currently on the field have this score. And so if you want to compare yourself to the athletes that are playing now, if that's your goal, you have that comparison of the top 1%. Independent to RightEye, it also assesses your visual fatigue and dry eye. No other ocular equipment can do that on the market right now, so it can assess that. It also gives you your binocular issue, which means your eye teaming. And so she was challenged today. But so this is the horizontal tracking that you saw her do, where she was looking at the white dot on the black screen moving up and down. And that's an actual readout of her eyes and what they were doing as she was following that target.
For the record, when I did this the first time, I didn't have any distractions, and I did really well.
Yes.
This is still a really good score. So
but you'll really get an idea of how attention and focus plays into it as well, and why we do this in a quiet environment.
Yes. And so this is the Saccades, which is a speed and accuracy component. So you want her to be going to the middle of this target. You want this to be a pretty clean line, meaning that she takes a similar path each time, that it's not unorganized where she's coming out to the sides and kind of taking a different path each time. This horizontal one is trained more day to day, and so you see how pretty that is, how tight that is compared to this one, and that's what we want to see this become, especially for like a quarterback who's catching the ball and then looking up and having to go ahead and scan from there. So let me take you to the reading one.
This is going to be really funny.
You were probably listening to everything we were saying, right?
I was listening and reading at the same time, but this gives you an idea of...
Yes. So the great thing about this reading exam is that I can change the quality, the difficulty of this reading. So Sally just picked the first grade level just to demonstrate it to you. But as an adult, I would teach you test you at a 10th grade level. Okay, so that content is going to be different, and the verbiage, actually, vocabulary is going to be different. But what it does is it gives you choose the grade level that you want to teach at, and then it gives you a grade level equivalent. So this is really, really great for our early readers that are struggling, that are being held to demands of third grade or second grade, but they're reading at a first grade level. And it really helps the parents understand where that challenge is coming from. And then we can give them, of course, exercises and things to improve that reading. So it gives you this beautiful picture. These little green dots are where Sally's eyes fell on the words. And you saw like some of these right here are falling in between the words. These lines here, these red lines, are her jumping down to the end of the paragraph and coming back and rereading and attending. These blue lines are at
so probably when we started talking, right?
Yes, exactly. Yeah, you can see where her eyes were distracted. But this is the gaze replay. So this little green box indicates what her eyes are doing while she's reading that paragraph. So that's her pausing and talking to us. But you can see how her eyes are falling in between the lines or above those words. Is
that really common for those who are faster readers?
You'd be amazed at what you can see with this and how people are actually reading. For those of us who are used to reading a lot and speed reading, you'll actually see big jumps, going across lines. Sometimes you'll miss words at the front and at the end. And it's good to know what those tendencies are, because if you have to read something that's really important, you need to probably focus more on, reading the whole line and not doing the jumping. I'm reading about a cow in a farm, and so I'm like scanning already just to get as much content as I can to move on and listen to you at the same time.
Yeah. Right. So it's really neat because it gives us, again, the dry eye, the visual fatigue component. So this visual fatigue component is really important for me for younger kids that have really poor endurance reading or having a hard time finishing their schoolwork. So they're the kids that take an excessive amount of time to finish a worksheet because they're constantly having to reread that material or reread the instructions just to understand it and get the comprehension of what they're supposed to do in the activity. A lot of the times these are kids that just really benefit from a teacher coming over and helping them start the activity because it takes out some of the comprehension piece. But again, we're giving them assistance where if we address the visual demands and we address the visual challenges, then they can be successful on their own. And it talks also about eye teaming issues. So is one eye getting tired and then not contributing? And again, we're having increased stress in processing that information. It gives us a reading rate. It gives us regressions, which are really important. So that's how many times Sally went back to reread the information. So we might see that number is excessive in kids that have poor eye control because they're not grabbing each word like we talked about. They're grabbing every other word or grabbing words from the top sentence and the bottom sentence, and so they're having to reread that material a lot, which just increases that visual fatigue. Yeah.
So anyway, so that kind of gives you a good, summary of all the cool stuff that we can find out and learn about, so we can have more appropriate treatment plans and really help kids specifically with what their strengths and weaknesses are.
So if someone has a question and they're trying to figure out kind of how they can get in for an assessment or just any question in general about anything we've talked about, what is the best way to contact you?
So to call the office at 972-404-3077, that's for Integrative Pediatric Therapy. Or you can call Integrative Concussion Therapy if you think you've had a concussion or you know somebody who has and that this would be applicable. Or if you have an athlete who wants to improve in their performance, they can call
972-707-3355.
3355.
Perfect. Well, thank you guys so much.
Thanks.
Appreciate it.
Thank you.
Great.
Have a good day.
Thank you.